The NHS is in crisis, long waiting times, overworked doctors and mountains of paperwork. But what if there was a way to fix it? Meet Taiwan's Health Smart Card, a tiny piece of technology that's transformed their healthcare system. It cuts bureaucracy, saves billions and makes patient care faster. Could this be the secret weapon to saving the NHS? The NHS is struggling, and it's not just because of underfunding. A big part of the problem? Administration overload. Right now, nearly 6% of the NHS budget is swallowed up by bureaucracy. That's billions of pounds every year just on paperwork. Every time you visit your GP, staff have to process your records manually. If you need a hospital referral, more paperwork, lost test results, more delays, and let's not even start on the 15 million missed NHS appointments a year, costing the system over £1 billion annually. It's slow, expensive, and frustrating, but there's a smarter way to do healthcare. Let's take a trip to Taiwan, a country with universal healthcare and one of the world's most efficient medical systems. Their secret, the National Health Insurance, NHI, Smart Card. Every citizen carries this card. It holds their entire medical history, from prescriptions to test results, all securely encrypted. In Taiwan, patients can choose to visit any doctor. There are GPs, but also ones who specialize. If you have the flu, choose a flu specialist. Sprain your ankle, choose an ankle specialist. Whoever you choose to visit, the system pulls up your records instantly. No need to fill out forms or chase paperwork. The result? Faster, more specialized diagnosis, fewer errors, and massive cost savings. Hospitals don't need armies of admin staff just to move paper around. The system is so efficient that Taiwan spends just 2% of its healthcare budget on administration compared to the NHS's 6%. Now, imagine if the UK adopted a similar system. What would change? First, shorter GP appointment time, so doctors wouldn't waste half their time looking for patient history. Second, reduced admin costs, saving billions that could be reinvested in frontline care. And third, fewer lost records and medical errors. No more "we can't find your test results" nightmares. A streamlined system means a stronger NHS where doctors spend more time treating patients and less time buried in paperwork. Of course, no solution is perfect. There are challenges to consider. First, data security. So, storing medical records digitally means cyber threats are a concern. But Taiwan has strict encryption laws, and their system has been running for over 25 years without major breaches. Second, cost. Rolling out smart cards nationwide wouldn't be cheap, but remember, the NHS already spends billions on admin inefficiencies. Over time, the savings would far outweigh the costs. Lastly, public resistance. Change is hard. But once people see how much easier life becomes, faster care, less hassle, no lost records, adoption would happen quickly. The NHS is one of the UK's greatest achievements, but to survive the next century, it needs to adapt. A National Health Smart Card could be the first step toward a faster, more efficient and more sustainable NHS. What do you think? Could this work in the UK? Let's start the conversation in the comments. And if you want more ideas on fixing the NHS, don't forget to like and subscribe.